Cesarean section. What you need to know about cesarean section. A cesarean section, also called C-section, is when a baby is born via an operation through a cut in your abdomen and womb. It is a very common operation. Around the world, 1 in 5 babies is born via C-section. This can be done as a planned operation or as an emergency. If your healthcare worker recommends a C-section, they should explain to you the reason you need the procedure and the risks and benefits. Then you will be taken to the operating theatre. Usually, painkillers are given into the lower back to numb the lower part of the body. Sometimes medication to make you sleep is given, general anesthetic. A catheter tube is put into the bladder before the start of the operation. There are lots of reasons why a healthcare worker may recommend a cesarean section. For example, if the baby is in a difficult position, if the placenta is too low, or if the woman has had previous C-sections. These are all reasons for a planned C-section. If problems occur during labor, your doctor may recommend an emergency C-section. This could be because the baby is in distress, labor stalls or stops, or there is an emergency. There are risks when you have a C-section, such as infection, severe bleeding, blood clots, or damage made to nearby organs. You will need a longer hospital stay and have a longer recovery. Risks to the baby might be a small cut or breathing problems after birth. There are also risks in future pregnancies, such as needing another C-section, a low placenta, the placenta growing through the scar made by the previous C-section, or the womb opening up, rupture. So, remember to use contraception after the baby is born, for at least 2 years, so the scar can heal and is less likely to open. It is important to give birth in a healthcare facility the next time you have a baby. Sometimes another C-section is needed, but sometimes vaginal birth is okay. Your healthcare worker will discuss this with you. Recovering from a C-section will take time. Painkillers and rest are important. Drink plenty of fluids and eat well. Because of the scar, you will not be able to lift anything heavier than your baby for at least 6 weeks. You will still be able to breastfeed your baby after a C-section. Taking care of the wound is very important to stop infection. Keep it clean and dry. Your stitches may need to be removed by a healthcare worker. You should speak to your healthcare worker after a C-section if you have heavy or smelly bleeding, you feel unwell or have a fever, your wound is red and painful or has pus coming out of it, one leg is bigger than the other or painful, or you have difficulty breathing. All of these can be warning signs and should be checked by a healthcare worker quickly. A C-section is a common way that babies are born. There are some serious risks and complications, but these are rare. Most women and babies recover very well.